This is Barnestorm training for the task of navigating point of care. In this session, we will cover logging into Barnestorm Point of Care using the first screen of Point of Care, which is the Select Patient screen, to find patients and visits, and shortcuts on how to maximize your speed and efficiency with Point of Care. We'll also cover using the Help screen and synchronizing. To get started with Barnestorm, double-click on the Barnestorm Point of Care icon on your desktop. This will bring up the login screen. In the login screen, you will type your password and click Login. This is very important. If you put in the wrong password 3 times in Barnestorm Point of Care, there is a security mechanism that will lock you out of the software and also erase all patient names and social security numbers from your computer for security purposes. If you forget your password and you have logged in incorrectly, you will get a prompt in red letters saying, "Wrong password attempt number 1." If you try a second time, you will get a pop-up screen saying, "You have attempted to log in with the wrong password twice." If you attempt a third time, the patient information will be removed for security purposes. So after 2 unsuccessful login attempts, if you are not sure about your password, the best thing to do is close out of the login screen and contact your office to get your correct password. Once you get the proper password, log in. Once you have logged in successfully, the main Point of Care screen will come up. On this screen are several shortcuts to help you get information quickly. One of the most useful shortcuts for clinicians is the My Patients button. This pulls up a list of only patients that are assigned to you. Because it's a short list of patients, it's easy to quickly scroll down and find your patient. However, all of the patients in the system are still available to you if you need to find them. To select a patient from the list in the main screen, simply click on the patient's name, and a summary of the patient's information will appear at the top. When you pull up a patient using My Patients tab, or by entering the first 3 letters of the last name, or the first letters of the first name or the chart number under the patient search, a list of patients will appear with the following information. The first line shows the chart number, the patient's name, the city where the patient lives, the date the patient was referred, the date the patient was admitted, the age of the patient, the gender, the number of days the patient has been in the Barnestorm system. The word active indicates the patient's status. Another status you may see is RBNA, referred but not admitted. This is the type of list that will appear by default in a normal search. To do a search for discharged patients, select the discharge bullet, and this will pull up some RBNAs, referred but not admitted, and discharged patients. The second line of the patient information includes the codes for the program and payer. Beside the codes is the text that describes the payer. In this case, the payer is a Medicare home health patient. And if you look down lower, you can see a Medicaid patient. And if the patient has a private insurance like Blue Cross Blue Shield, you would see that here as well. Underneath the city is the phone number for the patient and the end dates of the last valid 485. This will let you know when the 485 will expire. Once you have selected a patient, the patient's information will appear at the top of the screen under the selected patient. And this is a good place to look to make sure you have selected the patient you need. There is also a section at the bottom of the screen that populates additional information about this patient. This section shows recent visits, scheduled visits for this patient, recent 485s, and recent OASIS. Under the Recent Visit tab, you have a list of visits to the patient with the most recent at the top. The visit listings include the discipline of the employee who made the visit, the date and time of the visit, the clinician who performed the visit, and the type of visit. Common visit types are scheduled visits, subsequent visits, recertifications, start of cares, and PRN visits. To see the details of any visit, whether you made the visit or another clinician did, you can click on the visit and then click on the print button right above. And this will pull up a view of the actual visit note. If you want to print the visit note, you could click on the print icon at the top, or if you want to close the view screen, you can click on the close button, or you can click on the X at the top of the screen, and this will close out that screen. You can also use this method to view 485s for the patient under Recent 485s. Select the 485 you want to preview and then click on the print button. And this will bring up the 485. The same is done for Recent OASIS. Let's choose another patient. You can click on the OASIS and then click on print. And this will pull up the long view of the OASIS, showing both questions and answers for you to review. One of the other shortcuts you will use frequently is My Recent Visits. Clicking this button will give you a listing of the recent visits keyed into the system in the last few days. By default, the number of days that it gives you is 14. You can reduce the number to reveal a smaller listing or increase the number to show a larger listing of visits you want to review. Within this listing, you will see the chart number, the patient's name, the visit date and time, how many minutes the visit was, the visit assessment type, which could be a scheduled visit, a start of care, a discharge, a recertification, and the visit status, whether the visit has been marked as completed or locked. One of the things you'll want to pay attention to on the My Recent Visits listing is the visit status. This is important because you will want all your regular scheduled visits to be locked as quickly as possible, preferably on the day the visit was made. To do that, you will want to use My Recent Visits and check the visit status column, which will note whether the visit is complete, incomplete, or locked. Any visits with the status incomplete or completed needs more attention. You will need to edit them and ensure that they are complete and then mark them as locked. The reason why locked status is required is because locked visits are ready for billing. There may be some visits that need to be reviewed, such as a start of care visit that produces an OASIS. Usually, OASIS visits will be reviewed by your supervisor. However, most of your visits are scheduled visits that should not require a supervisory review. Therefore, it is your responsibility to complete all the documentation and lock your daily visits in a timely manner. The My Recent Visits allows you to look through all your visits and check to see which visits are locked and which ones are not. This gives you a good idea of which visits you need to go back and complete. In order to edit and complete a visit, simply click on it, and that patient will appear at the bottom. Click on your visit in the Recent Visit area in the lower left, and then click on the Edit button. If your visit is incomplete or completed, the Edit button will appear and you will be able to click on that. This will open the visit and allow you to make your changes. One of the most useful shortcuts on the point of care main screen is the My Schedules button. This is a button that you'll use all day to pull up your visit schedule so you can see which visit is next. If you select this button, a list appears of all the visits on your schedule. This button is only active if you use the schedule portion of Barnestorm software. Creating schedules in Barnestorm is covered in a separate video. The My Schedules button will pull up a list of all the visits that you are supposed to do starting with today. For you to start a visit under My Schedules, all you need to do is click on the visit, and it will pull up the details of this visit. And then above the list of visits, you can go ahead and click on the Start Assessment button, and this will launch your visit. If the scheduler coded your visit, the visit will already have all the codes provided for you. At this point, you can start your visit by hitting the Start button and move forward from there. The great advantage of using My Schedules is that you will not have to fill in all of these codes as you normally would using the New Visit button. That is a good advantage in getting the correct coding here, as well as saving time for the clinicians at the time of the visit. The other advantage of using My Schedules is that you can see all the visits listed here. Every visit that you need to perform is listed here for you. Some other buttons that are associated with My Schedules screen is the New button. If you click on the New button, you can schedule a new visit, or if you click on a visit already here, you can click on the Edit button, and this will bring up the information for this visit, and you can change maybe the type of visit to a recert or a different type of visit, and then hit Save and Close. And if you click on the Print button, you can print out your schedule for the week. Another useful shortcut on the point of care main screen is the My Expiring 45s button. This button allows you to view your list of patients with 45 certifications that are going to be due soon. In this list, I'm looking for the 45 through date, located down here, which will tell me when I will need to do my certification visit for these patients. This screen shows that I have a few recertification visits coming up. I have one coming up on August 30th, September 1st, and one a little bit later on September 6th. I will need to make the recertification visits within the 5-day window for these patients. When I click on one of the patients, I can check the Schedule Visit tab at the bottom to see if there is a recertification visit on my schedule. If not, I can click the one that should be the recertification visit and click on Edit. And I can change it to a recertification. Then I will click the Save and Close button and save the scheduled visit. Some other features you will want to use as you begin to use Barnestorm Point of Care are the Recent Orders button and the Pending Orders button located at the top. Any recent orders that you have created in the system will be listed under the Recent Orders. Any orders that you have started but did not finish will be listed under the Pending Orders button. This is an important list to monitor because pending orders will not be sent to the doctor until you have finalized them. Be sure to click this list and complete any orders that need to go out to the doctor's approval. CCNs are Care Coordination Notes, which are a great way to share patients' information between visiting staff. The Recent CCNs button will allow you to see all the CCNs that have been written recently and all the CCNs that other clinicians have written about your patients as well. Another useful shortcut on the Point of Care main screen is the Print Meds button. If you need a medication printout for your patient, you can get that from the main screen by selecting your patient and then click on the Print Meds button. You have the option from here to print the med checklist, instructions for the patient, the medication profiles, the schedules, a complete history of the medications, and a short list of medications or interactions for the medications. This listing can be done for all meds or select meds. Clicking the Preview Print button located at the bottom after you've selected your options will allow you to view what the medication printout will look like. The print icon in the upper left corner will print the med sheet to whatever printer is connected to your computer. Another function we'll review as part of the overview is the Help button located on the main menu at the bottom. Within Barnestorm, the Help button will allow you to find answers on anything that you do and anything that is available in this training. All the topics that you can get help on are listed here, just like the buttons on your Barnestorm main menu. So if you need help with one of these buttons, you can go ahead and click on it. For an example, if I click on Search, I will get the how-to article on the search button options in the system. For each task in Barnestorm, the how-to articles are listed here on the Help page. So you can go ahead and click on the article, and when you're done reviewing the article, you can right-click and select the back button, and this will bring you back to the list. If you cannot find an article you're looking for, you can click on Find More Answers here, and this will bring you to our knowledge base site, and you will find more articles on this topic. If you click an article and you scroll down, there are options on the right where you can email the article, print the article, bookmark the article, and export the article as a PDF, which will save on your computer. Another function on the Help page is selecting the Chat tab. From this screen, you can start a chat with a Barnestorm Help Support technician. This can be a chat for any questions that you may have, whether it is something you don't remember from the Barnestorm training or something that you would like to learn about in the system. You can type in a chat with the questions down here, and you can also select the category that you have a question about, and then you can select the Start a Chat button. From here, you will need to click on Run, and you may have to click on Run twice, and this will start a chat with the Barnestorm technician. From this chat, you can type your questions in the white portion of the chat box, and the Barnestorm technician will type a response. The Barnestorm technician may also ask to have remote control access of the session, in which case you will get a pop-up, and when you click OK, this will allow the technician to control your mouse. One of the other functions that you will need to know about in Barnestorm Point of Care is synchronizing. The Synchronize button is located on your main menu down at the bottom, and when you click on the Synchronize button, it will pull up the Synchronize screen. For more information on how to use the Synchronize screen, see the Synchronize video. You will want to synchronize as frequently as possible. If you can only synchronize in the office, then you will need to synchronize when you arrive at the office and when you leave the office to be sure you synchronize as much data as possible. Synchronizing sends all the information that you have on your laptop into the main office. This includes orders, care coordination notes, visits, and any other documentation you have in the system, as well as messages. At the same time, when you synchronize, you will receive information that other people have done in the system, as well as new admissions into your laptop. Synchronizing is how you keep your information updated and send your information back to the system. You don't have to have anything finished when you synchronize. If you have a visit that is unfinished, for an example, the visit will simply show as incomplete in the system. You will have time to complete your visit. Again, synchronizing should be done as often as possible. And this concludes the general overview of Barnestorm Point of Care. For more details, you will find a separate video on each topic in the Barnestorm system. Each video will go into more detail for those options.